Today we are at Arkansas Urology talking about new clinical trials taking place. So I'm so happy to be joined by Dr. Henderson and of course Chris Shinup, who's going to be talking more about the foundation here in a moment. Dr. Henderson, I want to start out with you and just talk all about these clinical trials. So first of all, why is research so important to the patients here at Arkansas Urology?
Great question, and thanks for being here. Research is what brings new treatments to our patients, and we like to be on the cutting edge here, and that's one of the reasons I moved to this practice in Arkansas, was to be part of a really forward-thinking, cutting-edge practice. What we're able to do is bring new treatments for not just cancer patients, but also people with erection problems, overactive bladder, urinary tract infections, incontinence. Everything that we treat here has at some point been in a clinical trial. These treatments wouldn't be available if previous people hadn't conducted the trials and previous patients hadn't allowed themselves to be part of the trial.
Talk about some of that reluctance of someone being a part of a trial, and why would you just encourage them to be a part of a trial?
Yeah, well, a lot of people think, they hear the term clinical trial and they think a guinea pig. Am I going to be just put through a ringer and not treated like a person? And it's actually the opposite of that. In clinical trials, these are all government sanctioned, right? So there's nothing shady about it, nothing mysterious about it. You can go onto clinicaltrials.gov and read about all the trials. They're right there out in the public. And you get a lot of actual hand-holding, right? When you're in the clinical trials, you have extra appointments, extra lab work, extra office visits, and you get a real, like a concierge experience. And that's what the patients get out of it. Plus, they get the satisfaction of knowing they are part of the future. They are part of bringing new treatments to other people. And so, far be it from being a guinea pig at all, a lot of the time patients have access to medications they wouldn't have access to because they're not available on the market yet. I've had a number of patients with different kinds of cancer who actually, through clinical trials, got to extend their life experience for 5 years or more. And then also that experience brought that out to be available to other people in the future. So it's very rewarding for the patients and for us as clinicians to be able to say, you know what, that thing that I'm seeing now on the front of the Wall Street Times, I helped bring that to the American public.
That is really neat
it's
to be
great.
A part of. You had mentioned some of those clinical trials that are taking place. Are there any that you're personally really excited about?
Yeah, so right now we've got some bladder cancer trials. Bladder cancer is a third most common malignancy in men, very common in the state of Arkansas. There's a link between smoking and bladder cancer, hence the prevalence here. Bladder cancer has historically been treated through one of two ways. You catch it early, trim it out of the bladder, and then you put some treatment inside the bladder with a catheter. Or if you don't catch it early enough, you have to remove the entire bladder, in which case a patient has to wear a device to collect the urine. That hasn't changed since the 1970s. And we have some new treatments that we're experimenting with that might be able to save patients having to go to wearing an appliance or have to come back in for such a recurrent disease. Bladder cancer, of all the cancers, bladder cancer recurs so often that it is the highest expense in Medicare of any malignancy.
Did not know that. Very interesting. Of course, we are in a lab right now. Just really quickly, what are we standing in front of?
This is a serum analyzer. When you go to the doc and they check like your electrolytes or your blood count, it goes in a machine like this. That's where the results come from.
Okay, very interesting. Thank you so much for joining me. Chris, I do want to segue over to you and talk about the foundation. Big things are happening for Arkansas Urology Foundation.
Ansley, this is what it's all about. We have a great team of physicians like Dr. Jonathan Henderson. I'd be remiss if I didn't mention Katie O'Brien, who's our research director also. But our Arkansas Urology Foundation really just raises funds, heightens awareness for all these great programs. And, it's a privilege just to be able to kind of highlight that today on Channel 7.
There's something called the Arkansas Urology Symposium taking place. Explain what this is.
Yeah, so Dr. Henderson's going to be one of our speakers. A bunch of our doctors are going to be talking, just kind of highlighting the importance of going to the doctor, of all things urology, of what we treat, reminding primary care physicians while we're the experts. And I think there's also a link to research when it comes to that, and that's just reminding primary care physicians that we do clinical trials and they can send patients over here to do some of the projects that Dr. Henderson was talking about.
Like I said, big things are happening, gentlemen. Thank you both so much for joining me today, and we will have more Good Morning Arkansas after the break.